in much of Europe, the Omicron wave actually hit them after it hit much of the United States, including Ohio. Fortunately, some in Europe, including the Netherlands and Denmark, appear to have passed their Omicron, and they're now declining. But while our Omicron surge was primarily driven by a subvariant known as BA.1, theirs has been largely driven by a later subvariant known as BA.2. But whether we talk about BA.1 or BA.2, we're talking about Omicron. What we've learned from our European counterparts, especially in the Netherlands, is that while BA.1 are closely related, BA.2 seems to have an edge on its cousin BA.1 in terms of being more contagious. Nevertheless, they seem to have similar severity, be similarly responsive to vaccines, and very importantly, it's rare to see a BA.2 infection after a BA.1 infection, which means immunity to BA provides good protection against BA.2. So, what's the dynamic of BA.1 and BA.2 here in the United States, which, unlike much of Europe, endured a massive wave of BA.1 before the arrival of BA.2? The CDC tells us that across the country, as BA.1 is fading, BA.2 is assuming a growing percentage of the declining of Omicron cases. To use a baseball analogy, BA.2 is playing cleanup, but probably won't hit a home run.